Right. Multi-partner global operations are a treasure trove of ideas and capabilities for innovation. But to bring forth these ideas or to unearth those capabilities is indeed a daunting task. Here comes the role of the pivotal role of any global organization. Such kind of organizations, kind of bring together people and ideas and opportunities. So as a part of such a partnership, one realizes that the ease of doing things and the challenges are not harmonized. So at each stance, it's a different experience. A very forthcoming form of research support in such scenarios arrives as organizations who build, support, sustain, and link these innovations. Today, we will be hearing from one such organization, PATH, which works towards accelerating health equity while addressing global pressing health challenges. I am happy to introduce and welcome Rishabh Chopra, who leads the Strategy and Partnership Development of South Asia at PATH. Welcome, Rishabh. A brief about him. He supports creation, development, and implementation of interventions that accelerate public health innovations by collaborating with NGOs, government, and private sector partners. He has experience across financial reach, strategy consulting, project planning, and designing public-private interventions, and project implementation, business development, and donor engagement. Basically a vast experience. He has played a key role in creating and implementing large-scale private sector engagement for tuberculosis in urban slums in Mumbai, has set up multiple interventions, including improving supply chain for family planning commodities, antimicrobial resistance in Sri Lanka, and global health securities agenda in India. Rishabh works at the intersection of philanthropy and public health impact, forging partnerships with Bill and Melinda Gates Foundation, USAID, Center for Disease Control and Prevention, the Fleming Fund, and Rockefeller Foundation. Before joining PATH, Rishabh was a strategy consultant with Intelgap and had also consulted at Bill and Melinda Gates Foundation. With that intro, I welcome you, Rishabh, and request you to tell us about PATH.
Thank you so much, Aradhana, to you and to IGIB for giving PATH an opportunity to present and talk about our work and what work do we do under our research definition. So great, and so sorry to all the attendees for being late. Again, technology fails you when you need them most, but then ultimately it worked out. So let me project a deck.
Sure.
Just a moment. And Aradha, let me know when you are able to.
It's visible. If you could put it into slideshow mode. Yeah, that's fine.
So the first disclosure is I am a management graduate and I have a lot of experience in strategy and partnerships, but I am not a doctor, not even PhD or not even MBBS, but I work with a host of public health experts and sort of work towards looking at partnerships and how we can sort of establish and scale up programs that are of utmost importance. And I've been with PATH for more than 7 years now, so I can claim to some of these designing some of those conversations. So I'll start with a brief introduction about PATH, where we are present. So we were set up 43 years ago, as the vision was how we can sort of help bring innovation for improving public health impact, and that, I think that vision has stood the test of time. Right now, we have about 1,800 people across the globe, and we have offices in 20 countries. Of course, and we work in two ways. One is the cross-cutting programs that are part of our global teams, and then the other part is the in-country work that we have offices in, which obviously is based on what the country needs in terms of the disease burden or the requirement of the current ecosystem. So we have known to partner with a host of organizations on the private sector, academia, the startup ecosystem. And on the right, if you see, some of the innovations that we developed have reached the scale where vaccine vial monitors, every vaccine will have a vial which has color coding. So that came out of a partnership with the private sector entity long back, I think late 80s. And then we worked on fortifying rice, adding iron and folic acid, and that is reaching to millions of people as we speak. And then we've done a lot of work in malaria that reaches a lot of lives in the African countries, especially. So that's about the global presence of paths. Talking more about our work in India. So essentially, we are a technical agency, and just how does work happen in public health, right? There's the government that is running the disease control programs. Health is also a state subject, so a lot of funding and a lot of planning happens at the state level. Then you have the districts of these various vertical disease control programs, and then you also have in cities municipal corporations who also often take up the implementation of these programs, which reach the end user, the beneficiary. We mostly engage with the health ecosystem, which has the health providers, doctors, practitioners on the supply side, and also work closely with the national, state, and district level of these programs. So on the left-hand side, we work at different levels and also with different stakeholders in partnerships across multiple diseases. So, and which is why we have a sort of, our bench strength is mix of public health and management, people from finance and operations and supply chain. And then the other thing is we also work at different levels, the National TB control program, AIDS control program, and then we work with multiple states and also at facility level to test out new innovations and then see how they can be integrated in the public health space. We have expertise across various thematic areas in health domains, and it covers the whole ambit of infectious diseases, communicable and non-communicable disease as well, and a lot of work on vaccine development, which I'll talk about later. And we have a family health vertical as well that focuses on maternal, newborn and child health. And then there is a digital health team that looks at new digital solutions that can enable program delivery or that can support the Ayushman Bharat digital mission that the government has launched. So essentially covering that sort of the variety of work that can be possible in public health. In terms of where we work, in terms of geography, this is the India view where we have multiple people across the country. We are about more than 700 people across multiple states, and the number is about 28. And if you see the map, the darker the color, the more number of programs we have in that state. And it also means that we have a state technical unit that is working with different actors in that state from a public health perspective. And this really expanded last year. Actually, 2 years ago now. I keep saying last year. Now we are in 22. It's been 2 years of COVID pandemic in India. So we've been working since April 2020 when the pandemic hit, and we set up these support systems in multiple states. Initially, in the first wave, it was about looking at supporting the information flow within the government, some data analysis, and just the initial response. And then later it became sort of a larger support on respiratory care, training and oxygen, and also how do we work on COVID testing in laboratories. And this is where we also are in close coordination with Dr. Rajesh Pandey from the Your Institute. So just to share the breadth of the geographical presence that we have. This slide is very busy, but also very interesting. It also just gives you a glimpse of any public health organization cannot work alone. And we have this broad range of partners, starting from the different funders that are there. And even there, it's a mix of individual foundations. You have these multilateral agencies like ADB and World Bank. Then you have the US government, USAID and CDC, PEPFAR. Global Fund is a big partner. And then if you see on the right hand side, we also work with pharma companies and diagnostic manufacturers. Being a non-profit, we are non-conflicted. So we don't support a particular product. but that also gives us the ability to partner with multiple kinds of organizations. So Godrej, GSK, Philips are our current partners. We work very closely, as I said earlier, with government. There are a few states where we have MOUs signed with the state to work with them on multiple disease control programs. And also, more importantly, institutions that have been set up by the government, like BIRAC or National Health Authority, which are focusing on specific aspects of driving some of the innovations from to scale. The other piece is also partner institutes with a lot of medical colleges like AIMS and BB Korala Institute in Nepal. CMC Vellore is a big partner. Then there is the set of partner NGOs, other INGOs or local non-profits that are working on various causes. And I think each partnership is dependent on the disease control area, the work that I earlier mentioned to you, which spans across. And then there are corporate partners or industry partners, let's say the Serum Institute of India or Bharat Biotech, which are vaccine manufacturers. We do a lot of work with them under our vaccine portfolio, and also consulting companies like BCG, IQVIA, EY, where they come in with a specific skill set, and we complement them with our public health knowledge and close coordination with the government. So if you look at this, it is a wide sort of array of different kinds of partners from different sectors. It also sort of says that we value partnerships a lot, and I don't think there's any project at Path where we work alone, because impact you'll only reach when you are working with multiple partners who are acting in a coordinated manner. So that's the draw on the partnerships. Now I'll move to more sort of research specific projects which might sound more interesting to this audience. So what we did was we have sort of divided the presentation in two parts. One is there is a specific vertical at Path which is called Monitoring, Learning and Evaluation, MLE, which is a cross-cutting vertical which spans different programs. And that team is led by Dr. Ekant from Path, and so that provides support across programs. And then there are certain projects which have a strong research component that get funded by donors, which we'll talk about. So the first one here is tools for integrated management of childhood illness. This is a multi-country grant which is funded by UNITAID. And if you see the countries in red where there's direct intervention and the ones in yellow where there's soft touch landscaping. So the idea is that there is a big gap with respect to identifying the root cause of a high fever case, especially for the smaller children, less than 5-year-old. And I'm talking about the setup in, let's say, in urban or rural areas where the symptom is just high fever. So what do you do with that case? And often it's some kind of medicine, but also in that age group, there is a dearth of good diagnostic tests that can determine what is this about. Of course, this project started a while ago, before COVID. Now everyone knows about pulse oximetry, but not so at that time, where we were trying to figure out new ways of diagnosing the root cause of the illness, and also looking at a clinical decision support system. This is a global partnership with the Swiss TPH and Path, where we are running this multi-country trial, research trial in these countries that are named here. And in India, we are working with multiple districts in Uttar Pradesh. The other part is looking at the impact and cost effectiveness of using some of these tools, call it operational research, and also looking at what kind of clinical decision support system is useful for the treating doctor or the healthcare provider that is looking at these cases of fever. That's the other interesting bit of having presence in multiple countries. We get to collaborate and understand what other countries are going through, and then there is a coordinated response of what we can, what support we can provide. Moving on to the next one, this is a very interesting activity we did late last year, where we were looking at the immunization for COVID in the private sector, and these are private healthcare facilities. So we're looking at what are the challenges and barriers for doctors to get these vaccines, and also anything from the training and supply chain perspective. So we did an interview of multiple providers in hospital facilities in Mumbai and one more place in Maharashtra, and then tried to understand what are the barriers. Because if you remember at that time, there was a large COVID vaccination program that was launched by the government, but the private sector was sort of not really keen at that time to take it up, early days. So we did that study and figured out the barriers to access, which some of it is mentioned here, the differential pricing of vaccine in the public and private facilities. And then there was a minimum order that the vaccine manufacturers were asking for the healthcare facilities, which becomes difficult for the smaller facilities because they don't know how many patients or how many sort of people are going to turn up for COVID vaccinations. And the other part was the cumbersome documentation and reporting of COVID-19, the stock and the registers. And then we gave some of the recommendations for how we can improve that. So again, it was done through formative research, through engagement with FGDs with these doctors, and also one-to-one interactions on a qualitative basis. There are also some results if you're interested in the vaccination site. The characteristics, we chose the sites in a way that they are representative of the general provision of care in the private sector, and in Mumbai, in Thane, and in Nashik. And then we visited the facilities with a 5-member team. Basically, each facility where there is a 5-member team, as per the recommendations and guidelines of the government for taking care of the entire process of giving the vaccine, and also looked at what are the challenges with stocking and supply chain, if there are any stockouts in those areas. And then we also found out the values of the differential pricing. Of course, with the government, when the manufacturer can afford to reduce the price because they're getting huge orders for volume, not so much in the private sector, but there are some of the values that we sort of covered for the different vaccines that were available at that time. So normally we'll do this kind of research and then write a research sort of abstract and sometimes a paper as well, and then also inform. This work was funded by the Asian Development Bank, where they were trying to figure out what could be a barrier for the private sector to take that up. Of course, things have changed very rapidly with COVID. Some of the research questions which were relevant even a year ago are not so much today because the world has changed. But that's the sort of on-site work that we've done. There is another interesting sort of intervention that's going on in HIV, which is and STAR is basically a project funded by again UNITAID, where it started with many countries in Africa. Is where testing is a barrier for any patient or anyone who has suspected of HIV. So you have to go to a facility and get tested. And I think that program has worked well for many years. But now there is also a need for enabling, like we saw in COVID, the home test kits which are available to people for their own convenience. So there are self-testing kits for HIV. There are currently about 6 manufacturers in India. And this is again a multi-country program where India is one of the countries, and we are working with in the country to figure out what could be these operational pilots, because there is a policy recommendation from NACO to have self-testing enabled, but it's not available as of today, neither in the market or in the public systems. So we are working on different models with multiple agencies. I think this project has about 14 different partners, from NGOs to academic institutes, ICMR research institutes, and all those manufacturers that are making these kits. And we're really trying to figure out what are the mechanisms through which these test kits may be made available for the people who need that, especially in the key population group for HIV, and then use it in a setting that then informs the system that what is the best way to roll it out. And will you give it to a private chemist? Will you give it to clinics that are set up by non-profits, or will you give it to self-help groups that are there especially working for HIV awareness? And then that work will inform the government. So this is something which is a massive initiative. And I think one part of it is also, like we work in the vaccine space, is working closely with the manufacturers of these tests and figuring out what are the regulatory barriers that they need to get clearance from. And also once they make that product, what is the price point which will be useful for the government to, let's say, procure one day, or even the states which will be using it, and as well as what would be the price that a general user would be willing to pay for a test like this, and that involves some information collection and interviewing a bunch of people, and actually looking at these models. And one point to note is, in many of these pilots, as we call it, generally costing is looked at just the price of the test, right? For example, let's say COVID vaccine, the price that, let's say, an entity is paying to procure, but in reality is much more, because you're also training your healthcare providers to administer the vaccine. There is a lot of effort that is spent in moving the vaccines or drugs from one place to the other, and then there is also a lot of time spent by the staff in doing that in the ground. So what are the health systems costs that are often not documented or seen? So in all of these projects, we try to figure that out as well. Then there are also research with respect to the projects and programs that are running on the ground. For example, this is, and I'll take a little bit of time to explain. We also work a lot in neglected tropical diseases. These diseases have been there for a long time, but they are not as prevalent as, let's say, the bigger infectious diseases like TB and HIV. And these are generally caused by a vector or a fly. And you may have heard of lymphatic filariasis or visceral leishmaniasis. So we do a lot of work in the state of Uttar Pradesh to support the government in trying to reach elimination for many of these diseases. And for lymphatic filariasis especially, there is a mass drug administration that happens, that you identify a population and then give them drugs, so that then it works as a preventive therapy for when that actually the disease doesn't happen. So you can prevent it from happening, and also improving the coverage. So this was a mixed study that was done in UP, and I think it was done to inform the program, the government program, of, let's say, how well, as they call it, the MDA campaign has been going on, and what is the coverage and at the district, block, and village level, because this is a sort of a large intervention which requires a lot of planning, pre-delivery planning, and also looking at whether it was effective or not. So that evaluation of the intervention package of the MDA coverage, that was done in 2 districts of Uttar Pradesh, and the results were out, and we published the results as well. And the key findings which are mentioned here is we're trying to find out what are the awareness levels of lymphatic filariasis at the households, and that could be done through surveys. And we did a baseline and an end line in Varanasi and Chitrakoot. And what is the change in the drug consumption pattern, again from a baseline to end line, and this data actually shows that there was improvement from what the government, the program that was doing it on the ground. So then these interventions also inform the disease control programs of how well are they doing. Then there is also this sort of looking at the Pulse Polio campaign, which was a huge success over the years, and looking at what are the specific strategies that can be leveraged from the polio experience for the MDA campaigns for LF, as I earlier mentioned, and then looking out for barriers and then enablers, which are mentioned here. So a lot of it involved a lot of interviews with the program folks on the ground and the healthcare workers, and also the general population, and the barriers, as you saw, recording and reporting of cases, the training and capacity building and supervision, and also how to enable that, doing micro planning and going through the entire process, and making sure that there are enough people on the ground to go and administer these campaigns. And a large part of it is also how do you communicate with the general community, what they say as IEC campaigns that are very important. And then those are some of the lessons that we picked up from the Pulse Polio program that has shown success across, because polio is one success story, that one of the many success stories that India has, and a great example to the world of how we sort of achieved elimination and now continuing it to the extent that it doesn't come back to us. And then the other important piece is, of course, in many of these health programs, the interdepartmental coordination that needs to happen at an early stage, because there are different health programs, but you're going to the same community with different messages. So how you can integrate that programming and also communication with the ground. And of course, the one strategy may not work for all campaigns. You need to think on your feet and change with the changing sort of environment in that particular district or that region. The impact was, of course, the intervention package taken by the UP government that to be included in the implementation plan of 51 days. So the recommendations, then they saw the light of the day, and then it's being currently implemented by the government. So that's success for any program or a project. The other large piece of research, and I'm just seeing if, yeah, I think I was supposed to, I think my colleague also, Tushar, was supposed to join. He found the same challenge that I had. Aditya, if I can just take a pause and share the link with Tushar, if that's okay. Just taking a pause for 2 minutes.
You can join in through the, the attendees login, right, and then I can. Absolutely. So I'll anyways begin the section, but it's better if he talks to, because this is the work that we do with vaccines, various vaccine manufacturers, and he's best placed to sort of even answer some of the queries that will come in. So I've just WhatsApped him. Link. Great. So I've sent him a message and hoping he'll join soon. So there is a center of excellence, actually. It's called Center for Vaccine Introduction and Access. It is a multi-country team, works across a path, and we have a bunch of scientists and researchers and people who've done clinical trials before part of this team. And as most of you would be aware, that the vaccine development is a long process of in lab trials, and then clinical trials and animal studies, and then getting into commercialization and getting all the regulatory approvals before you can get to manufacturing and rolling it out. Of course, with COVID, things changed a lot, and countries actually gave emergency use for many of these vaccines. But I think in general, it takes a lot of years to work on this, and especially on focusing on vaccines that the private sector may not be generally interested, right, for diseases which are of importance from a public health perspective. For example, there's still research going on for a vaccine for tuberculosis. We don't have that today. Long back, we didn't have something for meningitis and for rota, right? So rota virus vaccine was, so we supported Serum and Bharat Biotech in developing the two different candidates, and they are now part of the government immunization program. And of course, the whole focus there is how we can make life-saving vaccines widely available to women and children. It's a large large population which needs these vaccines, and there's an important piece of working on the research and development part in such a way that we can use cross lessons from different manufacturers and also help them through the initial time of when they are sort of working on the development process itself and the introduction and then commercialization. So the CVR's current portfolio, as we say, is working on more than 24 vaccine candidates, either in development, in already use. These could be early stage or stage 2 and 3, and 18 different diseases. And you can see it's a wide variety of diseases that
that impact many health indicators like diarrhea, malaria, meningitis, pneumonia, and polio. And some of these vaccines are already out there. Some of these are seeing the light of the day, but it's so we've had a long standing. In fact, we began our work in India with these partnerships in early 90s, where we worked on a meningitis vaccine that is widely prevalent in Africa, and I think that became game changing when it was launched, and it prevented multiple deaths from happening. So that's about the severe work. And what is the offering that we provide to these manufacturers, right, in India and the world? So basically, to develop new vaccine products that are very, and those two words are very important: appropriate and affordable for use. So as you know, that there's a lot of investment that goes into vaccine development, first on the research side and then also the manufacturing side. It's a complex process that very few companies over the world have access to. And I think now that whole landscape is known by the general public because of COVID. But I think our focus is how we can make those vaccines available for low-income countries, and how they can be procured at volume so that you can reduce the price. So our take with these manufacturers is, you are free to sell the vaccine for whatever price in the private sector, but when you are working with governments or countries, you agree to sort of have a ceiling price, and then we can sort of come in with our support. And that support is across on the right hand side with the manufacturing partners like Bharat Biotech, BioE, and Serum. And we provide technical project management and sometimes funding support to these partners, and really looking at their manufacturing practices and seeing if they are following the good manufacturing practices, and also sharing a lot of knowledge accrued from one side to the other. And in doing so, we also partner with different actors like governments, labs, and hospitals for undertaking the clinical development capabilities. There are organizations like clinical research organizations called CROs, which many of these vaccine companies will outsource the research side. So we have a team of scientists, again researchers, who are working with these companies and making sure that many of these also follow the quality of the vaccine development, and also on the project management side, that timelines are met, and there's a lot of supportive supervision that also happens. I'm not sure if Tushar is able to join, but I'll just remind him again. But anyways, I think even if that's not, I'll try to carry on. The other part is, so it's all about partnering, right? As I said earlier as well, even with Sevia. And I think one of the important things that happened because of COVID, and you would have followed it, right? So there was the Oxford guys who had come up with this first vaccine that was commercialized by Bharat Biotech. There was one candidate by GSK, one by AstraZeneca, and then Bharat Biotech also had indigenous vaccine, right? So at that time there were only those two candidates, but then there were, I think, 6 others in the pipeline with various stages of clinical trials that now you can see the market. And one of the focus areas for Sevia is now how we can share this knowledge and develop in-country manufacturing capabilities, because India is lucky that we've had sort of these two vaccine manufacturers, and more actually, the Hyderabad and around the belt, BioE, and I think 7-8 others. But the other countries, as you saw, when the supply chains were hit, they were not able to procure from outside, and that was the long-standing challenge. So we also support Thailand and some of the other Southeast Asian countries through convening, through groups, and through having experiential learning sessions, from getting them to travel from their manufacturing bases to a center of excellence, where they go through a program of 3 to 4 weeks of going through each and every process, and then also sharing a lot of information on how that sort of knowledge can be shared. And then we also obviously partner with the other folks that I mentioned for the clinical research part. Some of the highlights, I think I did talk about the meningitis work in sub-Saharan Africa. The other very important piece is each vaccine needs to go through WHO pre-qualification for it to be able to be part of a list that countries can then procure, which the Gavi mechanism or otherwise. And we help these candidates go through that process of WHO pre-qualification and making sure that they are ready, because it's a long application. It takes a lot of time for them to move through the hoops. And as you see the impact numbers, so many of the folks in Africa have been immunized and prevented for meningitis A outbreaks. Of course, we've partnered with Bharat and Serum. And the other interesting piece is, which I would like to highlight here, is because we are non-conflicted and we don't support a company, we can partner with as many organizations as possible. So we also work with Serum and with Bharat to develop two candidates on the Rota virus. So one is Rotavac and the other is Rotasil. I think Rotasil is Serum. And now both these candidates are part of the government immunization program. So because we want to expand the market, doesn't matter who's coming with the technology. And then we've also worked with Serum to commercialize some low-cost pneumococcal conjugate vaccine, PCV, which also it's, I mean, you know, pneumonia, it's a lot of deaths happen across the world, and now Pneumosil has been pre-qualified by WHO. And we worked a lot. In fact, I think in India it started with working on Japanese encephalitis vaccine. Again, JE is prevalent in many of the East Asian countries as well, and mostly endemic in this region. So it was important to come up with that vaccine. And then when it became part of government program, of course, now the results are for everyone to see. We've also partnered with GSK to develop, I think, the first ever vaccine for malaria that got regulatory approval. I think it was considered for regulatory approval, and now it will be manufactured in India with Bharat Biotech under a technology transfer program that we are implementing with GSK. I think this has already been launched in multiple countries in Africa. I think Kenya and Rwanda, if I'm not wrong, and Uganda. And if this comes through, again, it will be game changing for areas which have a high load of malaria cases, and still there are some deaths that happen due to malaria. We also designed and developed the first auto-disabled syringe and vaccine vial monitors. We also work on these innovations that Arta was earlier mentioning, work with the private sector innovator partners, and then see how they can be used in public health settings. So the auto-disabled syringe is now a known name in the sort of public health industry. And the last part is also we're currently supporting the multiple manufacturers' clinical trials on COVID vaccine, and also through the COVAX facility, they can have an active role in getting their vaccine candidate as part of the COVAX, which can then be used by multiple countries for an equitable distribution of vaccine. And this is a slide that is most largely around the various sort of stages of product development. Some of you must be aware with this, where there is the whole process. It starts from the discovery phase. Then there's a preclinical trial that happens in phase 1 and phase 2 testing, and then the regulatory and pre-qualification stage, followed by pilot launch and then scale up. So it takes years to go through each and every phase, and if you're not following something in one phase, you can go back to the last phase again. So there is a lot of hard work that goes. So we've listed the work that we do in each phase with these sort of developers and researchers, and then with the vaccines. And the above ones that actually covers the portfolio of diseases that we are currently working on. And this is the slide that, being a non-technical person, scares me a lot. And this is something that could be taken by Tushar, but I'll still try to explain at various stages of the product development which are the vaccine targets, disease targets that we are currently working on, and those are also sort of categorized as enteric and direct diseases, malaria, and the respiratory care issues, and then zoonotic. And again, if I read through all those names again, I'll become confused. So I'll leave the slide for all of you to chew on, and hopefully not have a lot of questions for me to answer. But I think that maybe the last slide that I had again, just try my best to capture the breadth of work that we do, but ultimately it's about reaching public health impact. And with that, I think Aradhita, I'm not sure if Tushar was able to join, but apologies for that. But I'll hand it over to you. Happy to answer questions or anything else that you would like me to discuss.
Thank you so much, Rishabh, for giving that global overview of all the work that you do and all your partners and how you kind of team up with different different sectors and address the problems. I do not, his name was Tushar, you said, right? I don't see anybody. Oh, yes, somebody is joined. Yes, Tushar, now you can unmute and switch the video on, please.
Yeah, hi everyone. Sorry for joining late. I had issues with joining, but now finally I'm here. And Rishabh, you did a fantastic job. I'm sure I was not missed.
I'm so sorry, Tushar. I had to just go through, and I didn't see your message. I realized that you're not able to join. So sorry for that. But yeah, I think if there are any questions from the audience, shoot it for Tushar, and he'll be able to answer those questions.
Sure. So we have, I think, 2-3 questions. I'll go one by one. Divya asks, here you have collaboration with hospitals also for diagnosis and disbursement of kits to HIV patients. Would you like to comment on that?
Yeah, so I think the collaboration with hospitals happens at so multiple levels. Sometimes we'll partner with, let's say, an institute like CMC Vellore, or let's say King George Medical College in Lucknow, to pilot test some of these programs, the TIMC program that I earlier talked about respiratory care, and see how those pilots are working with within the hospital, because it has to be sort of integrated with their workflow management. At times, we'll also pilot test some new technologies that may enable sort of improved healthcare delivery, where we will have a defined time period. And then the other piece is, of course, the clinical trials and the research that we do with Civia, where some of these partners are also there within the laboratory developing some of those work. So, Tushar, maybe would you like to talk about our partnerships with medical colleges and hospitals on the Civia side, if there are any?
Yeah, sure. So as far as the labs are concerned, like we have tied up with the enteric disease lab in CMC Vellore, the lab of Dr. Gagandeep Kang, with whom we have done extensive work on rotavirus pathology and rotavirus vaccine. So that's one lab which comes to my mind immediately. And then there is a enterovirus research lab in Bombay, with again whom we had a tie-up to do some polio assays. And not only India, like we have tie-ups with the research labs world over. One lab that again comes to top of my mind is one at the University of Maryland, where we do path-breaking early stage research on vaccine candidates. And then there is another lab called Bismedere in Siena, Italy, which does a lot of flu work for us. So yeah, as Rishabh said, we have tie-ups with labs, we have tie-ups with research sites. Of late, we have done capacity building at a lot of research sites world over, especially in Africa and Latin American countries for running phase 3 efficacy trials for COVID vaccines. And in the past, obviously, we have worked for sites in India, like the KEM site in Pune, or the CMC site in Vellore, the NICED in Kolkata, the SAS site in Delhi, and various medical colleges, be it PGI or SGPGI or Jammu Medical College. So host of colleges where we have worked with.
And just to add to that, what Tushar mentioned, the other two ways in which we work, so we focus a lot on lactation management, as in the human milk which can be donated, and the government has multiple centers in India which are called as comprehensive lactation management centers, and then there are lactation management units. So we've had a long-standing partnership with Sion Hospital in Mumbai, which I think they were the first milk bank to be set up in Asia in 1986. And now there are about 100 milk banks across the country. And we're working with some of these to sort of establish them as zonal medical reference centers, and also work on sort of improving the in-lab process of how the milk is expressed by mothers, how is it stored, how is it then distributed and then donated to other children that need them the most. And we're also looking at a digital tool to sort of automate the entire workflow, because everything is happening on paper these days. There we have partnered with the Lady Hardinge Medical College in Delhi, with King George Medical College in Lucknow, and I think 5 more states, MP, Odisha, Rajasthan, where we're providing the support. And then during COVID, we worked a lot with the laboratories in Maharashtra, Punjab, and Meghalaya and Mizoram on looking at these new technologies that were coming up for COVID testing, the RT-PCR, of course, but also the rapid tests, and seeing how we partnered with the Indian School of Business, the Max Institute of Healthcare Management, to see what efficiencies can be brought in by using these technologies, and also some of the software tools like cloud pathology, which will automate the whole system of capturing a sample and also then reporting for the test and then uploading it to the ICMR website. And I think something that I will mention here is Dr. Rajesh and Adatari here. We've been working with IGIB to set up these whole genome sequencing labs in places where we got a request from these multiple states, and where I think we also sort of informed them that there is an INSAPOW consortium that we part of, and connected them to Dr. Rajesh to sort of take them through that quality control process. We got some funding to donate the machine, but also tie up with the private companies that are doing the bioinformatic analysis. Genotypic is one such company. So doing those trainings and then now seeing how are they sustaining genome sequencing beyond COVID, right? And a large part of it is, can we use it for other diseases? So we are also working with NIRT in Chennai for seeing how that can be used for tuberculosis, and what are the lessons for in other areas for One Health and other infectious diseases. And I think the other question that you had, Divya, I think is distributing HIV kits. So much less on distributing HIV kits, but then just looking at the entire ecosystem of what are the policy guidelines, what are the models through which these kits, which actually were approved for research purposes, because they are not yet out in the market or being provided by the government. So we work with these civil society organizations that are grassroots NGOs working with HIV key population, and then looking at these models through various partners. There, of course, there are ICMR research institutes, NIV, I think, that we are partnering with to make sure that the manufacturers that are manufacturing these assays, they are tested in these laboratories and sort of verified if they are efficacious for the testing of HIV and if they are meeting the guidelines that the country has set. So that piece is also, I think, one of the major focus areas for us. So I don't know if that answers your question. It's a long answer. Sorry about that. Sorry, Aradhya, we can't hear you. Please unmute.
Sorry. Yeah, no, that was fine. Thank you so much for answering. I see a hand up and I'll allow you to talk. If you could ask your question, please. You can unmute and ask the question. There's no name. It's a Galaxy M12.
I think, and I see one from Dr. Ajesh Pandey, elaboration of help to serum, I think, and Bharat Biotech will be helpful to understand the paradigm of engagement. We did cover it in the presentation, but happy if that, we're happy to, and I think Tushar can add more of our partnership with them.
Tushar, could you unmute, please? Yeah.
Sorry, so I didn't get the question. The question was about partnerships with Bharat Biotech and Serum?
Right.
Oh, yeah, like Rishabh would have told you that we partner vaccine manufacturers world over. And in India, we have had key partnerships with Bharat Biotech, Serum Institute, and much more recently with the Biological E. With Serum Institute, the story started much earlier in late 2000s when we partnered them for Menafrivac, where PATH was involved in providing technical support. So basically how we assist these manufacturers is by providing technical support and funding, both to develop the product at the factory, at the manufacturing facility, as well as helping these manufacturing partners in conducting clinical trials. So with Menafrivac, in late 2000s, we helped Serum Institute in developing that product. And we also ran clinical trials, a small clinical trial in India, but a large clinical trial in Africa, which finally led to a WHO pre-qualification of that product. And now that product is saving millions of lives in sub-Saharan Africa. Apart from that, we have had a close working relationship with Serum Institute for development of Rotasil, which was again a technology transfer from National Institute of Health in US, which we helped with. And then Serum scaled up and developed Rotasil, and we were the partners for the key phase 3 efficacy study of that product in India, where around 8,000 participants were enrolled in 6 sites. And successful completion of that study led to the licensure of that product in India, and finally introduction into the immunization program. And it also subsequently led to WHO pre-qualification. And now that vaccine is being introduced in a lot of African countries under the immunization program. Apart from that, we have also worked with Serum Institute on some other products. Then now coming to biologic, Bharat Biotech. With Bharat Biotech, one of the key success stories has been Rotavac, which is again a rotavirus vaccine candidate, which was a multi-agency collaborative arrangement where DBT was also one of the partners, and the US-India Vaccine Action Program, along with the government of Norway, were all partners in that. And we again helped Bharat Biotech in the pivotal phase 3 efficacy study of that product in India, which was run at I think 3 sites, which subsequently led to licensure and WHO pre-qualification. And now Rotavac is being introduced world over, like in sub-Saharan Africa, where it is replacing Rotarix in the immunization programs, because Rotavac is very easy to administer and it is 10 times cheaper than Rotarix. So those are two, three key vaccine candidates that we have helped develop these manufacturers with. And now much more recently, we are helping, and for Bharat Biotech, another example that comes to my mind is RTSS, the malaria vaccine, which was initially developed in partnership with GSK. And now that technology has been transferred to Bharat Biotech for scale up, and Bharat Biotech will be manufacturing that vaccine. And for biological E, we are helping them with a COVID vaccine candidate, which was very recently licensed, the Corbevax, which is a subunit vaccine. So we developed that in partnership with the Baylor Institute in US, and subsequently that technology was transferred to biological E. And biologically, though conducted that study, the phase 3 efficacy study on its own in India, and I believe in 2-3 months back, that product was licensed by biologically and is now available for administration, especially to kids over the age of 12 years. So those are the candidates that come to my mind immediately when we talk about partnering Indian manufacturers. I'm not sure if I answered your question on that.
I think Rajesh Pandey has written, like, thank you, the details shared help clarify. Thank you for that. Divya has again asked another question. Do you also help establish more partnerships for procuring patient tissue samples for research purpose?
Short answer is perhaps no, but I think what we've done over the years is make a collaboration across medical colleges across countries, and we did that for COVID, where we looked at environmental testing of COVID samples for COVID and from fecal matter and the water that flows in the drains, and that was a multi-country sort of project management activity that PART did, and CMC Vellore was one of the partners, and there were 6 other partners. I think the bigger challenge that we see globally is data sharing across countries, and also having access to samples at the right stage from the public health setting, right? So the people in the lab, they look for good quality samples, and often these samples are not in the quality that will be tested well. So that the other access challenge that we have. In the TV program, we have worked on looking at the whole process of sample collection and transportation outside the lab, and how to make that more effective, and making sure there are sort of training in place, but not directly the question that you had. I don't think we play any role in that.
Okay. Thank you so much, Rishabh and Tushar. I don't see any more questions over there, but then thank you so much for coming and speaking to us about your initiatives and how you work. And I also thank all the attendees before I close the webinar for today. Thank you again.
Thank you so much.
Bye-bye.
Thank you.
Bye.
Bye-bye.